Hey, my name is Dr. Cozy. It's really nice to meet you. Did you find the office okay? Okay, good. And before we get started, can I just get you to verify for me your name and date of birth? Great. Thank you. So, I am a psychiatrist here at the hospital, and my job is to help patients come up with a diagnosis and then work with patients to create a treatment plan. I don't do counseling necessarily, but there will be a bit of counseling included. That's just not my primary role. And then once we come up with a plan, I will check back with you to start probably every 2 weeks, just to make sure that things are working for you, that you're feeling stable, and that everything's okay. Yes, I can definitely help you coordinate with a psychologist to help you with the counseling portion. It is always recommended that along with treatment, you do therapy, so that way everything works together. So, if it's okay with you, I would like to go through and ask you some questions. Some of them are going to be a bit personal. Some of them might be a little strange, but they all help me paint a clear picture about what's going on with you. Good. And then the other thing I would like to do in conjunction with asking you those questions is I would like to place some electrodes on your head that are going to allow me to read and record your brain waves. I would also be placing a little clip on your finger to help and record your heart rate. And that way I can see if there's any sort of spikes, any change in your brain activity while we go through this appointment. That's okay with you? Okay, great, thank you. So, let me just put my clipboard down for a moment. And I'm not going to touch you or anything without first putting on a pair of gloves. So, how are you feeling right now? At any point during our visit today, if you feel unsafe or any kind of trigger occurs that triggers some negative emotions, I want you to let me know right away, okay? That's very important. So, I'm just going to take out a few electrodes here. So, alright, I'm going to need to place these on different points on your head, which will require me to make physical contact a little bit. Is that okay? feels uncomfortable again, let me know. So the first one is just gonna go right in the center of your forehead. So just there. Okay. And I'm going to need to use my ruler here. No, we have a man down, but that's okay. I can pick that up later. So those are all placed. just going to snap on to each electrode. Each one has an assigned sensor that is going to be reading different brain activity. Okay? So just making sure that I assign the correct electrode to the correct lead. Sorry, I know it's a little bit of pressure, but I gotta make sure that these snap on correctly. This one's gonna go on your forehead. I'm just gonna feed it around so it's not just hanging in your face. Okay. And then this guy here, just gonna clamp on your finger. Either one. Perfect. Okay. I can take off my gloves. Yeah. If it's okay with you, we can begin with the question portion of our visit, okay? Now, if any of these questions feel overwhelming or you don't feel comfortable with answering, it's completely okay for you to say skip, okay? And we can revisit these potentially at a different time. But these questions are specifically designed to help me get a very clear picture of what's going on with you, so that way we can come up with a specific treatment plan that has a good likelihood of being successful, okay? So, okay. My first question that I have is, how would you describe your sleep? Like your sleeping habits? Do you feel like you wake up frequently throughout the night? Do you feel like you sleep well? Do you have a difficult time falling asleep? Information like that. Okay? And do you find yourself waking up frequently? Okay. Have you ever experienced something called sleep paralysis, where you wake up and you find yourself unable to move? On occasions where this has happened, have you ever experienced hallucinations? experienced hallucinations outside of sleep, just during the day? It can be auditory or visual. Like, sometimes we will hear, for example, somebody calling our name. Okay. Do you often have trouble concentrating? Do you ever experience something we would call hyperfocus, where you become so focused on a task that it feels like you lose time? Do you struggle with organizing your thoughts before speaking? How about, do you ever experience racing thoughts? Okay. How about any thoughts or ideations about some sort of impending doom? Do you often lose time or forget what you were doing? How frequently would you say this happens? Do you struggle to find motivation in terms of beginning a task? And while performing tasks, do you often find yourself becoming distracted? Do you have a difficult time getting along with people or reading social cues? Okay. How about, do you experience panic attacks? How frequently? And are you able to pull yourself out of these panic attacks? Or do you have a difficult time grounding? Okay. Do you frequently feel any sort of feelings of deep, profound sadness or worthlessness? Okay. And how frequently do you feel this way? Okay. I'm going to go through a series of tests with you. They are going to be measuring how well you're able to focus, as well as if there are any points that you do become distracted, and how frequently this occurs, okay? There is no incorrect result. It is just helping me get a picture of what's going on with you. I'm also going to be doing a little bit of an exam, a cranial nerve exam, because oftentimes our mental state can be tied into neurological issues that are affecting our brain. So it can be helpful for us to get a really clear picture that way, okay? And like I said before, if at any point this makes you feel uncomfortable, if you feel triggered to experience any negative emotions, I want you to let me know right away. Put this to the side for a moment. Maybe not there because I think it's going to fall. Put it here. Okay. Okay. So here I have two lights. I have a white light and I have a red light. Okay. So what I'm going to do is I'm going to be moving the white light. I want you to tell me at what point you see the red light blink, okay? And I also want you to try to keep track of how many times you see it. Okay. So So, how many times did you see the red light flash? So now, focusing on my light again, I want you to tell me how many fingers you see me hold up, okay? focusing on the light. And one more quick test with the pen light. You don't need to do anything other than just focus on my nose, okay? And just taking a look at the reactivity of your pupils. In the clipboard. So I have a series of different cards here that have this is sort of an older test, but we have found that the interpretation of these blots can tell us if you are experiencing a trauma response, okay? So, starting with the one that we have on top, when you look at this, what do you see? You can take your time. Okay. How about this one? Okay. And, excuse me, this one here. How about this one here? Okay. And this one. Okay. This one here. And this one. And this one here. Okay. For the next test, I will be making physical contact, but I will be using a cotton-tipped wood applicator to do so, okay? I'm going to have you close your eyes. and you're going to see me moving a light across your vision. While I do this, I will be making contact with the applicator, either the soft cotton side or the sharper stick end. And I want you to identify for me which end you feel. So before we begin, okay, I just want to make sure you're able to identify. So this, that's the sharp end, and this, that's the soft, okay? Did those feel different to you? Did you feel like you're able to differentiate between the sharp and the soft? Also, do you feel comfortable enough to be able to close your eyes? Okay. Good. So then go ahead and do so now, okay? Okay. So, with your eyes closed, are you able to perceive the light? to be flickering my fundoscope here in and out of your vision. And I want to just take a look at your retinas, seeing how the light reflects. So try to keep your eyes open and focus on my nose again, alright? Just like that. You can relax. Alright. We have our recording, so I'm going to go ahead and remove you from the monitor. So removing the electrodes. Okay. Take that back. Put this to the side to be sanitized. Okay. Then removing if there is any kind of remaining residue from the electrodes. It's pretty easy to remove just using an oil, whether it's baby oil, coconut, olive oil, any of those will do it. But it doesn't look like there's any adhesive left behind, so I think you're probably okay there. sorry, it's important that I write a summary of my findings while you're still here, so that way everything is still fresh in my mind. So, okay. In order to gather a definitive diagnosis, the next step is I'm going to be providing you with some packets, which you'll be able to pick up from the front desk, okay? And these packets are a series of questions that I would like you to have either family members, friends, or co-workers, people who are frequently within close proximity to you, fill out. Because sometimes other people can observe behaviors in us that we're not always aware of ourselves. So we have you gather information with these packets so that way I'm able to form a complete picture of what's going on with you. Once we have this information, I will come up with a definitive diagnosis, alright? And we will be able to start a treatment plan for you so that you're able to start feeling better every day. Okay? Good. Because that's really important. It's important that we're able to feel comfortable in our bodies and, have a more positive outlook. And even, obviously, in life, there are definitely times where that becomes difficult, but there is a broad spectrum of emotion. And instead of having you bouncing from extreme to extreme, this way we'll be able to keep you within a more manageable range. No, we can't numb you completely, unfortunately. There are definitely days where I think we could all benefit from that emotionally, but it's important to feel things because that's how we know we're alive, even when those things are painful. But okay, do you have any questions for me for now? Okay. Well, you're always welcome to give me a call, even after hours. We do have an answering service, so I will always get your messages. And if it is an emergency, I can be paged. We also have a crisis hotline that we do provide for patients if need be. Okay? So if you feel like you're in crisis or it's an emergency, I want you to call. Okay, that does wrap up our visit today. So make sure on your way out you stop by the front desk and you get those packets, okay? And then they will schedule with you for a time to come back and for us to complete our diagnosing here and get your treatment plan started. They do also have a directory of different psychologists that you can speak to and start establishing care with. Just let them know what your specifications are, what you would feel most comfortable with, and they can narrow that down for you. Okay, great. Listen, it was really nice meeting you, and we'll talk soon.